Ladies and gentlemen, hello and welcome to the 6th Annual Pharmaceutical Leadership Summit and Pharmaleaders Business Leadership Awards 2013. Brought to you by Pharmaleaders, Asia's biggest and most analytical news media in healthcare communications. In an era where healthcare in India is the most neglected, as politicians and policymakers are busy scoring their political points, Pharmaleaders attempts to raise the uncomfortable questions ignored by other media houses, as we believe that healthcare is key to national development and India can't be a mute spectator where policy reforms in healthcare has taken a backstage over political issues. We need reforms. We don't need false promises. The nation needs affordable medicines with quality care and not empty and unreasonable claims. India needs enough doctors, working public healthcare centers, nurses and a robust policy, not just unrealistic and populist measures. We are sick of this. Ladies and gentlemen, Pharmaleaders believes that while industry today is at loggerheads with the government and various statutory authorities, including the regulators such as Drug Administration, Market Watchdog SEBI, and a host of other organizations, there is a lack of meaningful dialogue and interaction between the industry and the government, leading to the bigger uncertainty of the overseas players coming to India with the basket of products and investments, in the absence of a weak law and virtual policy paralysis. The issue of pricing is the biggest factor, leading to the discontentment of the pharma companies. The unavailability of medicines seen across the country is the major challenge, as well as the declining research and drug discovery. Clinical trials are seen as major deterrents. The Pharmaleaders platform, therefore, attempts to bridge the gap of trust deficit and infuse the sense of confidence of the country's drug makers. Pharmaleaders is an independent media that aims to ventilate the views of the common man through its magazine and digital version. It attempts to create a free mindset of opinions rather than following the chamchagiri of select few, unlike other media houses. Over the last years, Pharmaleaders, the flagship media outlet of Network 7 Media Group, has exposed many in the government and those in gaddis who try to dictate their own terms and build their own pockets, ignoring the pockets of Aam Aadmis, who are the real interface of the society. We don't intend to present a picture that is not true. We present facts, truth, based on factual data rather than on painted pictures without any substance. Pharmaleaders is India's first opinion-based and research-driven healthcare communication media and has a decade of relentless reporting in pharma journalism in an unbiased, fearless and independent way. Over the last 1 decade, Pharmaleaders has covered some of the biggest voices Ladies and gentlemen, Incredible Pharmaleaders 2013, Pushing India's Growth Agenda, is the theme of the historic edition of Pharmaleaders' 6th Annual Affair. The 6th Annual Pharmaceutical Leadership Summit and Pharmaleaders Business Leadership Awards 2013. Entering its 6th year, the much anticipated and awaited prestigious title is attempting to revisit the current state of affairs and the pressure of building brands and, most importantly, maintaining the sustainable growth record in an era where government's policy-making machine is making a difficult task to the thinking process and the strategies to retain market dominance. as Pharmaleaders is discussing today the key issues that are grappling the industry. Both domestic and international markets have been witnessing a change of approach. The price war, US FDA vigilance, FDI and generics are the key drivers that will determine the winning combinations. Indian pharmaceutical, rather healthcare landscape has drastically changed, paving the way for fresh and challenging pressures to the pharma leaders. The incredible journey of the pharma leaders, though marked by many ups and downs, the global healthcare industry are certainly not ignoring the meteoric rise of Indian pharma leaders. Pharma leaders believe that the challenges of the pharma leaders in the present context are multidimensional, though the bigger issues grappling the minds of the leaders are increasing pressure from regulators, FDI, clinical trials, and of course, the pricing. Originally launched in 1999 as the Pharma Business and Technology Excellence Awards, the Excellence Awards were first produced for the first time in India by the Pharma Business and Technology magazine as a means of honoring innovation in pharmaceutical marketing, corporate governance, and research and development, and Lifetime Achievements category. Pharma Excellence Awards were produced by Pharma Business and Technology Magazine Awards in India and expanded to recognize global corporate citizenship and individual achievements. Over the last 1 decade, Pharmaceutical Business Leadership Awards 2012 has been re-evaluated and recast to focus more on business scientific accomplishments in the biotech industry with a significant thrust in academic pharmaceutical research. The set of awards have been presented since the last 1 decade at a sold-out gala to over 500 industry executives and leading academic scientists from around the world. Each award or nomination is screened by the board members of Pharmaleaders Group, consisting of 5-member team, and then further approved by Network 7 Media Group juries, consisting of eminent members of the healthcare community. After thorough screening, the names of 4 nominees emerge and are thrown out to public by email voting, then SMS voting, followed by the final verdict of the jury members. The awards demonstrate how companies can, through their core business activities, help achieve excellence in innovations. The 2013 award nominations have been given explicitly to companies delivering inclusive business models which are sustainable, commercially viable business initiatives that expand access for low-income people to goods and services, or improve their livelihoods by engagement in value chains as direct employees, suppliers, or distributors, while also generating sales and profit growth. By bringing together examples of innovative, effective business practices, 6th Annual Pharmaceutical Leadership Awards will also provide leading businesses and entrepreneurs with a valuable platform for networking and sharing experiences and promoting best practices. This will encourage other businesses and governments to replicate and scale initiative. In 2012, the award categories received an unprecedented 1,172 nominations, representing a variety of business and commercial endeavors undertaken by business associations, non-governmental organizations, and individual companies from more than 9 countries, with a sample size of 5,56,674 voters, spread across 21 states and 4 industry verticals via online, SMS, and physical interviews. Past award winners have shown how companies can help boost sustainable growth and development. and they can be a tremendous source of innovative and sustainable solutions which help transform people's lives for the better. These nomination categories have been highlighting the critical role of the private sector in simulating sustainable economic growth and development. A detailed analysis of career graph or history or notable achievement is looked at to get the final 5 names, such as financial management, decision-making roles and business impact, business ethics, managing rapid growth, innovation, adapting to change, strategic partnerships, leadership roles, marketing strategies, corporate philanthropy to society. Ladies and gentlemen, the journey that Pharmaleaders undertook till date has been marked by many momentous, outstanding and long-standing occasions. Each year, we hosted the Pharmaleaders program. We only meant to salute the visionary leaders, small or big in size or in financial numbers. We had a clear agenda that we are not going to follow the routine and stereotype award nomination mechanism, where there are only selected companies, personalities who are constantly in the limelight. Pharmaleaders broke the rule book and made an exception. We looked at people who are working behind the scenes and never wanted any media glare nor any publicity. Our research team took a gigantic task of uncovering the unsung Pharmaleaders who have been spectacular in their own sphere, be it in healthcare, clinical trials, manufacturing, marketing, etc. Our quest of crowning the Pharmaleaders are twofold. Those who imbibed innovation with risk-taking abilities, to break the rule and make an exception, to show the world that they exist in their own world, in their own way, demonstrable leadership and critically acclaimed leadership. We were never tired. We continued to mix existing bigwigs with the companies and individuals relatively unknown and made them king. We looked at sheer passion, excitement and a sense of pride each time we crowned a Pharmaleader in the platform after a rigorous voting methodology. The Pharmaleaders have been tested and were thrown to the various stakeholders to vote. We even stunned some big names when the unsung Pharmaleaders were crowned against the mightiest of bigwigs. Pharmaleaders believed in the spark of innovation year after year as we continued our quest for celebrating the ultimate Pharmaleaders experience since 1999. We were the earliest media house to recognize the talents and created Pharmaleaders platform that were imitated by many, and Pharmaleaders Awards became the trendsetters. We are happy today when we notice the rise of companies in healthcare to honor the achievers. In the early stage of our momentous journey, we recognize the veterans and legends who are now no more, but our spirit of leadership is still reverberating in the reception of companies. Late Dr. Parvinder Singh of Ranbaxy, who built India's first MNC, Dr. Anji Reddy of Dr. Reddy's Labs, Mr. Indravadan A. Modi of Cadila, Mr. Jagdish Saxena of Elder Pharmaceuticals, or the former Drug Controller General of India, DCGI, Dr. M. Venkateswarlu, are the few notable names. The current Thespian legendary Pharmaleaders who are responsible for building the India image, like Dr. Yusuf K. Hamid of Cipla, Dr. Habil Khorakiwala of Wockhardt, Mr. Samprada Singh of Alchem Laboratories, Dr. D.B. Gupta of Lupin, or Mr. Suresh Khare of Indoco Remedies are in the list of Pharmaleaders Winners Library. Pharmaleaders has felicitated and recognized more than 500 companies and has created a world-class platform in the form of Summit.